We have, by my count, 23 minutes until we adjourn. So we have a very short amount of time to wrap this up. But I want to tell people that are still in the overflow room, there's now plenty of seats in the big room. And I'm going to take at least 5 minutes at the end to ask anyone from the audience who didn't get a chance to say something they think is incredibly important when we think about how we go forward from here. This wrap-up thing is where do we go from here? What are the ways forward? We've had lots of wonderful presentations. Katrina, did you have something you wanted to finish up with?
Well, I was going to introduce the three of you,
You don't have
but
to.
we have 23 minutes. So we're going to hear from Jackie Campbell, co-chair, and Alice Willman, Tom Foyt. Go.
Thank you, Katrina. And I do want to, though, thank Megan Perez, Rachel Taylor, and Dipali Patel. They're the ones that organized this thing from behind the scenes. I also want to thank Patrick Kelly, our wonderful forum members who have made all of this possible, and the planning committee for this particular meeting. I thought it was spectacular. I do want to say for my wrap-up comments, and they will be very brief, and when we ask people from the audience to speak their last thoughts in terms of way forward, it would be Twitter-size sentences. So first of all, there is evidence, we have heard it, for violence prevention, systems and programs that work. We have some terrific resource lists. A lot of terrific websites were given. They will be part of the report that will be written and will come out in approximately 6 months. We also, those resource lists, like the blueprints format, the crime solutions format of programs and systems that do work. We also focus, though, a lot on the evidence of things that do work and how to collect that and how to translate it, et cetera. But we also we're charged to think about not only evidence on what works, but also how to implement, evidence on how to implement programs, how to translate them, how to make them culturally appropriate and contextually relevant. And those are some of the things that we need to think about moving forward. We also need to think about what are the programs that work, what the in some of the areas that we did not cover. For instance, even intimate partner violence, there's not that kind of a resource available in one place for all the different sectors. We also, our forgotten form of violence is always elder abuse, and I wanted to tell everyone we are having a forum meeting on elder abuse on April 17th and 18th. And so that's one thing that we seem to neglect. The other thing that we do know is how important this endeavor is of violence prevention. And I wanted to take people to notice the December special issue of Lancet in terms of burden of disease that gives where violence is in terms of mortality, and importantly, where suicide is, which is even higher globally of a form of mortality from violence. So if you need that kind of evidence to show that we have a problem, that's a good source to get it. The whole notion of adaptation to the core elements of programs, how you determine what they are. And we oftentimes, when we talk about core elements or critical elements, I think sometimes we think that's only content, that's specific content from a program. But it's not only that. It's how that content is delivered, by whom. And again, that contextual context is incredibly important when we search for, to identify core elements of programs. I oftentimes think of the nurse-family partnership. And by the way, I'm from the Johns Hopkins University School of Nursing, not School of Medicine, as it says there. I'm a nurse. I have delivered home visitation programs. I have studied hard and trained some of the nurses that do the NFP. And one of the reasons I firmly believe, and so does David, that NFP works when delivered by nurses is because they have flexibility in both how they deliver that content, when they deliver that content, when they walk into a family's house, even though it's the day to address nutritional adequacy or feeding practices or whatever, they also are to address whatever problems that family is facing, and health writ broad, mental health, physical health, but also whether or not there's money to pay the rent. So, that kind of flexibility in delivery of the program is also important, and having the knowledge base to do that. And that's one of the things when we do home visitation using paraprofessionals, that's one of the things that they say. They have this toolkit, I'm supposed to say this about this today, but I walk into this high-risk family's house and there's chaos related to domestic violence or whatever, and I don't know that's not in my list of things to talk about today. So that's part of the issues in terms of delivering these interventions that do work, and what we need to think about when we make it contextually real. And part of the issue is, does that context, for instance, have a functioning and appropriate criminal justice system? Does that context have a healthcare system that can expand to do prevention kinds of activities? And that's one of the challenges from the low and middle income countries. And thank you to all of you that came from afar, because in the global reality, that's one of the things we really need to think about. Also, there's limits of surveillance as measuring outcomes after a program is implemented, especially surveillance in the traditional sense. And Arturo's example of homicide, just measuring homicide as being able to identify what works and how and et cetera, is inadequate. And I was struck by Chris Maxwell's graph in terms of the numbers of intimate partner homicides, because even in this country where we count bodies fairly well, those numbers are different from what the Bureau of Justice Statistics has on their website. And so just, first of all, just counting bodies ain't going to do it in terms of an outcome, surveillance outcome for the effectiveness of an intervention. But also that we need to think about, as was said, prevalence of risk factors and protective factors, measuring those as part of what we look at in terms of long-term evaluations. Two last things. First of all, we talked a bit about norms and attitudes, gender norms being incredibly important in terms of addressing for prevention of violence, especially violence against women, but also other forms of violence, but also the norms around violence, when it's okay to use violence, when it's appropriate, who can use violence, in what context. Those also need to address. That is very hard work, and I've been struck by what's happening in India now. First of all, in terms of, I know of all of the work that's been done in the last 20 years around gender norms in India and around trying to prevent violence against women. And yet we have a state of affairs where clearly incredibly much more work that can be done. But it also gives us the opportunity of a crisis, and oftentimes a horribly violent event in a country or in a community makes for change, and how we have to have the evidence ready to come in that kind of crisis. And Daniel Webster's Gun Summit at Johns Hopkins was a great example of being able to quickly draw together a lot of evidence and now be able to get it to policymakers when they need it. And then finally, we all agree that there needs to be a global fund for violence prevention, and we all agree that what Michael has said several times, that part of our foundation of these interventions and system that works has to be giving people hope. That has to be part of what we provide on a system level and an individual level. Alice.
Thank you very much. It was a great segue. I wanted to share a few insights that I had from today that I hope will be helpful. First of all, it's a pleasure to have been here. As Jacqueline said, I work at the World Bank, and we represent, as you probably know, we have about 182 member governments that are part of the bank, and that our clients are those member governments. So my constituents or my clients are different than a lot of your clients. We work at the level of, we have to work with the national government in everything we do. We can work at the local level, but only through the national level. So that's sort of my perspective of where I'm coming from. And the first insight that I'm getting from these days with you is the need, everybody's been talking about the need to break the silos around this. And I think it's very important, first of all, that the World Bank was invited to this and the Inter-American Development Bank was invited to this. That development institutions are more and more a part of what used to be, I mean, I don't want to say that we've been excluded from this. What I mean is that the violence has long been a public health issue. It's long been viewed as a criminal justice issue. It's more recently becoming viewed as a development issue as well. And this is something that my team within the World Bank works really hard to do, but it has violence has important economic impacts, and it also has really important economic and livelihood dimensions. It's not just about individual behavior, it's not just about health issues, it's about, for example, I was listening very intently to some of the presentations on intimate partner violence and gender-based violence. There are massive economic dimensions to that, and so if you can't leave an abusive relationship if you don't have somewhere to go and if you don't have an income to sustain you when you get there. And youth, for example, youth need jobs. And that is part of violence prevention. Infrastructure, which is a lot of what the World Bank does, is part of violence prevention. Building an environment, a built environment in a city where, for example, the streets are wide enough for police cars to get down. And that's one thing that we do that's kind of simple, but it makes a big difference. There are lots of places in the Rio favelas where police cars could never go until somebody came in and widened the streets so they can get in there. Building parks where people can be at night, where there are street lights that people can keep an eye on each other and exercise the kind of social control that we know is needed to prevent violence. Putting trees in those parks, for example, that are canopy trees and not bushy trees so you can't hide behind them. This kind of stuff, it's part of our conversation now, but I think we need to really make an even greater effort to work across those silos, because we have a lot. We can't, definitely we can't do it on our own, and I know the public health sector, you can't do it on your own, and we already saw the police try to do it on their own in some countries, and they can't either. We need to all be at the table. The second thing that keeps coming out to me is the question of how do we replicate or export what we've seen work in developed country contexts. And in my experience working with developing countries, what we are often more and more asked for is for interventions that address the economic dimensions of violence. So, how do you do a youth employment program that doesn't just keep youth busy, throwing cement over here for a day or two, but that actually integrates them into the labor market in a sustainable way and gives them the sense of belonging and citizenship that they need to channel their energy, and we know they have a lot of energy, toward positive social ends. How do we involve women in the economy in a way that minimizes their vulnerability to abusive relationships? How do we engage men in all of this in ways that build on their positive attributes, that don't treat them like problems, that don't treat them like beaters all the time, but that treat them as fathers, as community members, as leaders. So some of the interventions that are most promising in developing country contexts are ones that have a strong economic dimension to them that can help prevent violence, like microcredit programs that nobody thought of in the beginning when microcredit started, nobody really thought about the violence component, and then all of a sudden women started getting beaten when they came home with money that the men weren't sure how they got a hold of, and the men didn't understand where they were going when they were going to these community meetings and why they were coming home with money. And what we've learned is that when you engage men in a positive way and they see that as family income and they see their wives as partners, they can do amazing things with that money. And I don't mean to say that it's all, you know, kumbaya, we have a way to go, but it's definitely showing some promise, and we need to look into it more. Conditional cash transfers are the other area that we're seeing. Those are when families get a stipend for complying with certain conditions, like making sure their kids are in school, making sure their kids get vaccinated. We've started to monitor, in some cases, the impact on violence in the home with those, because a lot of times the transfer is given to the woman under the assumption that she'll spend it on the welfare of the children more readily than the man will. So, which, you know, that's not always the case either, but that's how those programs have been designed. And we're seeing some very promising stuff come out of that too. Youth employment, same thing. We're seeing some very promising impacts on youth violence through well-designed youth employment programs that teach youth the skills they know to be productive members of society. Same with our built environment, some of the built environment interventions that I mentioned. The other area that I think we need help with in terms of replicating this model or exporting what's been learned is going beyond the program level. And this is something that we keep hearing. I just heard it on the last panel a couple of times. You know, we've got some successful programs, but how do we take that to the next level? And especially in developing country contexts, you know, for example, with domestic violence, a restraining order, there's no criminal justice system. If you want a restraining order, you call your uncle to do it for you. You certainly, you know, there's no way. In shelters, nobody has housing. There's no way there's shelters for people to go to. So we can't put these programs into a context where the institutions are not supportive for those programs. They'll fail and we'll waste our money. So being able to work at that institutional level with governments, and this is what part of my job is how do we increase that capacity so that the whole system is functioning a little better so our programs can actually work. And I think that's one way we can move this agenda forward. And finally, about translation of the materials, knowledge sharing, what my colleague Joan was saying a little bit before, is making this more accessible to people in developing country contexts. And I think it would be a great idea if we had the next meeting of this in a developing country. That would be fabulous. Maybe Mexico. So the other last insight that that's been coming out of me the last 3 days or 2 days. Sorry, I feel like I've been here forever. Is the question of how do you talk to policymakers about this? And a lot of you are talking to U.S. policymakers, which is very different than the policymakers that I talk to. But I think part of it, you know, distilling our message, boiling it down, and also understanding what is meant by the word prevention. A lot of the problems that I have when I go, and I'm not mentioning any countries specifically, but you know, I go to country X and they're using the word prevention a lot. They're dropping it all the time. But when you get down to it, what they want security cameras and they want football fields. And sometimes what they want are gates and walls put up in the communities. That's their idea of prevention, because they want to keep those guys from coming over here. Or they want to keep an eye on those guys and have, you know, it's intelligence, it's not prevention. And so part of the task that falls on all of us is we've got to be clear about what we mean, and we have to make sure we are raising awareness about what prevention really is and why it's going to work better than cameras and football fields. And making it politically feasible, I think, is the bottom line too. I mean, politicians here in the United States are elected for for 4 years. In the countries where I work, maybe 18 months. I mean, they're elected for 4 or 5 year terms, but a lot of them don't finish those terms. So constant turnover all the time. And why would they take on a program that takes a generation to show the kinds of effects that they want, their constituents to see them having? So that's I think that's a question we need to think in taking it forward. And finally, one thing I just want to throw out there that I've been wanting for a long time in terms of really taking it forward is, why don't we have a global fund for violence prevention the way that we have had global funds for other issues? You know, if there's a global fund on HIV, if there have been global funds on all these other things, Why not? Why can't we think about a global fund that would help us finance some of these impact evaluations and the replication and the conversations that we want to have? Somebody needs to do that.
Thank you, Jackie. Thank you to the forum and the members. I feel privileged to be here for these days. A part of who I am is a problem solver. I tend to think of myself as a problem solver, and I've been working on problems. I've been trying to find a partner for a program that we want to launch. I've been trying to figure out how to move the management of this project to these people. And then I came here, and you presented this really big problem, right? Preventing violence on a global scale. And it makes my problems all seem entirely manageable now. But to be called to such a venture is indeed an honor, and I hope you feel that way as well. I have just a few things that I want to say that I think help to point out the way forward. Yesterday and today, there were references to the notion of incremental, cumulative, and continuous. This is an incremental venture, right? This is one where we're trying to build cumulative knowledge, and it's one that requires a sustained effort. I think Mark said something along these lines first yesterday, but then it echoed through it. Even my Assistant Attorney General said, for an Assistant Attorney General says, don't ever think that we have the final answer and we're done. That this is an ongoing pursuit to try and figure out what works, not just what works, but what works better. We never have just the final answer. And this isn't Professor Shore's word, but I can't help but think that we need to be omnivorous in this enterprise. She talked about all the types of knowledge that we need and all the types of resources that we need to draw on. And I think she's exactly right, including drawing on the wisdom of practitioners, right? Second, there was a really interesting conversation about the packets of knowledge. We talked about programs and we talked about practices. Mark Lipsey, if you know the work of meta-analysis and systematic reviews, I think this holds really, really great promise. It does two things at the same time. It presents, someone said at a couple different points, we ought to be paying attention not just to fully formed programs, but to elements, right? Components, elements of programs. And meta-analysis and some of these other strategies gets us to this more granular notion of what works, of program elements. And it also integrates our knowledge in some very powerful ways. It's not without danger, it's not without difficulty, but that granular yet integrative path that we're on in terms of massing our knowledge and massing our evidence is, I think, a very potent, will be a very potent resource for us on the way forward. Third, I want to say something about action because it bears repeating. Act on what you already know, right? And I think you've heard several people say words to that effect. We can't afford to wait until we're 99.9% sure. That's not the way the world works, and that's certainly not the way this issue works. Act on what we already know. Something that Dean said today, too, a challenge particularly for the research community, is creating a more rapid cycle of program development, finding a way to get information back into the program development cycle so that, again, as Mary Lou said, we're not done with this program. We're not done with this venture. We're not done with this intervention. We've just learned something new. Here's intervention 2.2. Here's version 2.3, and on and on. Along those same lines, Elizabeth Shore said, find ways to generate evidence that build partnerships. This is a venture that requires all of us. It requires the practitioners and the policymakers. It's too big a load for any one stovepipe to support. And finally, act on what you know. I was reminded of the movie by the title Carpe Diem. Carpe Diem, right? Carpe Diem. I once was telling Jackie, I once complained when I was a very young government bureaucrat. I once complained to a senior colleague. We were working on a project, doing some nice little science, and some policy issue came over the transom just on fire. And I said, gosh, I wish they wouldn't do that. We're trying to do some organized work here, and they just throw this stuff at us and expect us to react. And I said, and he told me, he said, look, you need to understand that the policymaker's crisis is the gasoline that drives your enterprise. And you need to figure out a way to jump when that opportunity presents itself. Daniel Webster and Mark had an interesting exchange yesterday about arriving on the doorstep of the policymaker either too late or empty-handed or both, right? That's yeah, but you at least show up, right? At least show up. You might be empty-handed, you might be a little late, but at least show up. And I have something more to say about this in a second. Finally, with a tip of the hat to Michael, I want to offer a couple of promises of hope, right? I think there are a couple things to be hopeful about. There were some things that have been said about standardization of evidence and evidence standards and the rigidity of methods and putting ourselves in boxes and RCT boxes and everything else. And in those concerns, the Office of Management and Budget was named as something that we're very worried about. And I want to say, and here's the note of hope, that the Office of Management and Budget is actually about some very good work right now, some very important work, drawing on some very promising work by folks at the National Science Foundation and the Department of Health and Human Services and Department of Education, on working on standardized frameworks for evidence. Now that sounds really scary, and in the hands of a bunch of budget analysts, it could be a scary thing. But there's a huge opportunity for folks like you, folks like us, organizations like the National Academies and the Institute of Medicine and this forum to influence that work by the Office of Management and Budget, because they understand that the current way that we think about evidence isn't right. It isn't working, and they want to get it right. We've got to help them gain the wisdom that was reflected in so many of the conversations here over the last couple of days. So that's my first note of hope. My second note of hope is something that comes from, again, this notion of showing up on the policymaker's door empty-handed. A colleague of mine wrote a paper some time ago entitled Evidence Generating Policy, not evidence-based policy, evidence generating policy. And the notion is this, is that if you can convince a policymaker that any time, right, the policymaker says, look, I haven't got time to wait for your study. I haven't got time for you to do your RCT and tell me what to do. I've got to act today. I've got to make a decision today. If you can take that moment and you can convince the policymaker that there are two things that present themselves in that moment. First, they don't need to be right in what they do. They just need to be wise. And if they can admit that they might not be right, they have an opportunity to learn something as they go forward with their policy decision. And you heard Chief Jim Bierman talk about the crazy world in which police chiefs operate. I think police chiefs, despite what Jim says, are among the most forward-leaning policymakers. They will say, look, I got to start doing a thing with the way I'm deploying my cops, but I'm willing to do it to half of them. and let the other half do standard operating procedures. And yeah, randomizing them sounds okay. We'll do this many precincts and that many precincts. But to convince the policymaker that they have an opportunity to generate knowledge by implementing their non-evidence-based policy decision and actually engage them in the business of generating knowledge is a powerful way to build new partners as well as to advance the field. So that's my second note of hope, and that paper is certainly worth reading and certainly worth including in your repertoire as you talk with folks about policy and how evidence drives those policy decisions. So thank you very much.
All right. I promised, I left this on, I was not supposed to do that. But anyway, I promised the audience that you have one last chance for the record, for the report, to say what maybe you didn't get to say somewhere along the line in terms of where we need to go in this endeavor. Dr. Humphreys.
Janice Humphreys from the University of California, San Francisco School of Nursing. I just wanted to say a phrase that I have not heard over the course of the past 2 days, and perhaps it was implied: mixed methods research. And I want to stress it because this is an opportunity in a rigorous way of bringing the voice of the participants and the stakeholders to the science. And in so doing, helping us to understand their definitions, their meanings for the terms we use. It also can give us the context on which they are living their lives and where we're trying to implement change. And lastly, it has the potential to help you all explain your non-significant research findings. So, thank you.
Michelle Maloney-Kitts, nurse midwife, director of Together for Girls, a public-private partnership that really does try to work in partnership across sectors to get this agenda going. I just want to remind everybody that in the development world, and particularly in the US, but amongst other donors as well, there is no earmark, no funds set aside, no budget code for violence prevention. So before we even start to, frankly, be so ambitious to think about a global fund for violence prevention, it'd be good if even we could get decision makers who are managing budgets to recognize that violence prevention is really an inherent part of the development agenda. And I would add to that, that as many of my partners in the room know, I'm constantly twisting around our work and proving, for example, that our violence prevention work is going to have HIV indicators, and I'm required to do that. It would be so lovely if we could ask that our economic growth programs and our ag programs and our education programs would also have violence prevention indicators, at least one or two, and we could agree to those. And that way we would be really advancing things. Thank you.
Jackie, you mentioned some of the important resources that we learned earlier today, and I just wanted to bring to the attention of everyone, too, that UN Women coordinates on violence against women that may be useful for both research and practice purposes. The first is the Virtual Knowledge Center to End Violence Against Women and Girls. This is an online portal in English, French, and Spanish. What we try to do is bring together the knowledge base on what works to address violence against women by different sectors with different population groups, and when implementing different interventions like safe cities, for example. That is accompanied with programming guidance along the programming cycle. So everything from what you need to do in terms of a situation analysis through to implementation, monitoring, and evaluation, and replete with tools that have already been developed that might be useful to inform a new process going forward. There's a tools database as well. It has over 850 resources for implementation that represent more than 60 languages. That's one resource. The other is the Secretary General's database on violence against women. This is a General Assembly resolution mandated database that governments have to submit responses to, and it houses measures that governments have in place. So you can go and look up by country or by measure which countries have laws on violence against women, which have national action plans on violence against women, which have conducted population-based surveys, which have trained the police, etc. also a very useful resource. And I'll give you the URLs for these, I think, in writing better. And then lastly, just not to forget about the United Nations Trust Fund to eliminate violence against women and girls. And although it's not focused specifically on prevention, a large part of the portfolio and the grantees do focus their work on primary prevention. And that is the only multilateral grant-making facility for this issue.
One more?
Suggest and ask that sometimes it's good to bring the real world. And so I would suggest that something going forward is to have like circles of dialogue between researchers and people who are translators of research and implementators of interventions, and having some kind of a circle of dialogue with the different elements. Because I am a translator of research, so what I'm going to do is from here to where I have to do. And I think it would be good for us to have policymakers also, staff working for politicians, because everybody here said violence is a very complex issue, is multifaceted. We need all kinds of interventions. So I think to have more diversity of actors.
I just want to make folks aware of a lot of resources we have on our website. As I said, we've replicated 200 instances of the Blueprint for Violence Prevention programs in Pennsylvania over the last 14 years. And these are not Pennsylvania's blueprints for violence prevention. These are the blueprints for violence prevention. So www.epicenter.org. We've developed logic models for each of those programs. We've developed implementation manuals. We have both process implementation and fidelity outcome measures that are free for people to use. So.
Hi, Ellen Schmidt from the Education Development Center. This has just been fabulous. I am so excited that I got an opportunity to be here. But I wanted to hopefully not reiterate too much, but we've been talking about translational research, and my work in injury and violence prevention has been either providing technical assistance or working in a state health department. And unfortunately, there wasn't a state health department here at the table, but next time we will. And that they can have a reach to our highest at-risk populations. The maternal and child health programs have direct access to those populations that we want to impact, so I'll make a little plug for that. The other thing I wanted to mention is that since we're talking about translational research, maybe we could encourage our researchers, when they do a summary of their program, to really talk about how will this information help implementation of these ideas. Or I know they often put in other research questions that still need to be asked, but can we get some of that work of how this can be used? And the last point I want to make is that we really need social media to help us, because if you think about every program that's been talked about here, half of them I bet you didn't all know about, okay? So how can we set up this information exchange where we really can find out about each other's materials without duplicating efforts? And I don't have a good answer to that because I barely know how to use my Kindle Fire, but I would charge the folks who know much more electronically stuff, because it's a good thing.
Mark, last words.
Last word. Thanks, Jackie. I'll make it. I'll follow the guacamole dip formula. I had 4 short points. First, I wanted to thank the presenters who came here. This was an extraordinary group. And if you would just stand, all of you who were on panels or presented, for just a minute for us to see again how many people there were. So I know some had to leave. Is there anyone here? You did a fantastic job. And thank you for taking the time to come to something as dull as data nerds and evidence-based effect on violence. The second point is you really made it come alive. I think there's an energy here, and you can feel it. And I don't think we've had any workshop that ended with quite this level of energy. And I would say it's the energy of fusion. It's of silos coming down and coming out of our little cracks and listening to what the World Bank has to say and what a policeman has to say and what researchers have to say, discovering new fields of implementation science that are new to us, new parts of the model for public health intervention, going into implementation science deeper than we ever knew existed. But I think the silos have really started to come down in a very, very exciting way. I think, third, we have struggled for such a long time in violence against this notion of fatalism. It's the counterpoint to the hope idea that violence is evil. There's always been evil in the world. You're not going to do anything about it. It's always been with us. It will always stay with us. So why even try? This notion of fatalism, unfortunately, is still alive and well. When people say you can't do anything, there's 300 million guns, give up, this problem is just going to stay like this. But I think this was a tremendous, tremendous effort towards overcoming fatalism and understanding ways forward. And I just want to thank people. It's been tremendous to have you all contribute and I think cross the barriers, cross the silos, and you show we can come out. We can come out of the silos. Not only is it safe, it's exciting and tremendously productive for where we all hope to go. So a big thank you to everyone.